So I really wanted to get involved with my Epilepsy Story organization because of one person. Her name's Brandy Parker McFadden, and she really is a dynamic person who I met and was really impressed with. Her energy, her passion, her dedication for the mission that didn't exist before she got into the space. You know, you spend some time with Brandy and you realize that this is an important thing that we all need to be doing. But it's her energy that keeps us going, and it makes it easy to say yes to. So it's really because of her. I think what's really great about my Epilepsy Story, you know, it's the only nonprofit for young women and for women and young girls. And that's an important area that we need to help address. There's a big gap. I will be honest with you, we don't have a lot of great resources for this group and population. And it's important that we have resources such as My Epilepsy Story that allows women to go to one place, they feel comfortable and they know they're going to get accurate and really good information. You know, the adolescent female patient from a doctor is one of my most special environments, and it's because there's so much that goes into caring for them. But now I have an opportunity to direct them to a resource that can be used for their education and their improvement of care, and that's a really neat thing for me to be able to do. Yeah, so the quality measure on proper transition of an adolescent patient to adult care got formed out of the need that exists and the gap that was currently occurring. So unfortunately, many children, when they become adolescents and before they have to transition to adult neurology care, aren't getting what we would consider to be a very proper transition. And proper transition has been studied by lots of people, and specifically by the gottransition.org organization, and they have really come up with 6 parameters that need to be followed before you could consider that patient to be properly transitioned. And so we wanted to incorporate a quality measure that had all 6 of those components. And there was some debate on whether you should, to be compliant with the measure, just be able to do 1 or 2. But it was really thoughtful that you had to be perfect, and because that's what the patients need. You know, that was what would benefit them the most. So to do it properly and to get credit for the measure, you actually have to do all 6 components. I think this quality measure will help patients in a lot of ways. I hope that it gives people a template of how to properly transition. It reminds people how and why they have to do a proper transition. And all quality measures, the goal is obviously to improve the patient's care. And if we know you properly transition them from an adolescent to adult care, then they're going to be better off in the long run. Studies have shown that if you do proper transition, that you potentially could decrease unplanned hospitalizations, ED visits. You can improve the ability for the patients to take their medications that are obviously very important. But most importantly, it's the right thing to do. And it's something that we can do to help make sure our patients continue receiving great care even after they leave our practices. You know, every neurology provider will need to know a lot of things as it relates to this quality measure. First, they need to familiarize themselves with the exact wording of the measure. Then the second thing they should do is identify that population of patients that this measure will apply to. Obviously, in this case, it's going to be adolescents. And so we really want them to understand who those patients are in their practice. Then the third thing that's going to be important for them to do is to then make a plan of how you're going to implement all 6 steps. There is a lot of resources that are available, and they're actually listed in the article that the measure is going to contain. But most importantly, they can just go to the gottransition.org webpage and get a whole slew of ideas and resources of how that can be implemented in their practices. Then the final and 4th step is going to be to actually implement these different 6 steps and follow the patients over time, and make sure you follow your data as it relates to this quality measure to be sure that you're achieving improvement. We don't expect everyone to start out at a high number or what we call a baseline. That's okay with any quality measure, but we would like to have people then use quality improvement methodology to take whatever baseline or wherever they've started and try to get better and improve over time. So the number of patients get better or more likely to have those 6 steps that are part of this quality measure. Yeah, I think there is a lot of consternation and sometimes debate and frustrations on quality measures, in that they are a burden or perceived to be a burden to the medical field or to physicians in already busy practice. And I hear that a lot, I do, but I also know that we are very vested in making sure we try to do this as easy as possible. But the real reason why this is important and the real reason why quality measures exist is for the patient and their family. We need to take their care in consideration and really try to make that care as best as we can. We're not trying to say people are not doing a great job taking care of their patients, but all of us, including myself, can get better. The quality measures allow you to have a metric or a way to collect and measure data that then you can follow over time as it pertains to specific issues of the care you're giving. And again, it's not important to be perfect, but it's to strive for improvement and work towards getting better over time. Yeah, and I think the other important things about quality measures is that we can sit here and try to ignore them, but then you're going to be left behind. It is no longer the future of healthcare, it's the current state of healthcare. Payments are going to be tied to these measures or similar measures, and we're going to be reimbursed based on that value that we provide and that quality of care that we provide. So it's one of those things where you better get on board or you are going to be left behind. And I promise that the American Academy of Neurology, the Child Neurology Society, the American Epilepsy Societies, we are trying to help bridge that gap, try to improve what's available, because if we don't do it, somebody like in the government will do it for us, and I promise you will not be as good as if it were done by neurologists. The last thing I would say about the quality measures in general, whether it's this one about transitioning or the other ones that are available, are you don't have to implement every single one right away. The idea is to start with a few, look how you do over time, improve that progress, and then add to it. If obviously the gap goes away and we are doing everything as it relates to these quality measures, those measures will be retired. Now, when a measure is retired, it doesn't mean that it's unimportant anymore. It just means that we've done our job and it's time to move on, but we just got to continue performing at that high level. So one of the things I'm really proud about of how we do epilepsy care at Nationwide Children's Hospital is our comprehensive care model. So it was back in 2011, and it was a year before the Epilepsy Across the Spectrum report came out, detailing of how you should provide epilepsy care. And it was one of my passions of trying to set up a way we could really deliver the care that these patients and their families really need. I was really awestruck by how limited knowledge I had as a medical provider on some of the most important aspects of quality of life, psychosocial issues that always or can occur with epilepsy, school problems, young women issues as far as it relates to pharmacy and folic acid and other kinds of aspects of medicines and interactions. So we created a model that addresses all those things. I said, I'm going to stop being the person that has to do it all and bring those resources to the family during their visit, at their clinic visit. And so in our clinic, we have two social workers, we have a neuropsychologist, we have a behavioral psychologist, a genetic counselor, a pharmacist, and then they're supported by the Epilepsy Foundation of Ohio, which is a representative from that group is actually in our clinic. And we all partner with the medical team, either being a physician or a nurse practitioner, to provide that care for the patient and their family. It is our mantra to say it's not just about a prescription, meaning that there's more to your care. You may not need all those resources, and that's absolutely fine, but if you sure did need those resources, they're there and they're available for every one of our patients in our comprehensive care model. We absolutely love it. We feel it's going to improve the quality of care that's delivered and save money in this value-based care healthcare system. We're going to decrease hospitalizations, ED visits, and again, most importantly, improve the quality of life for our patients. I think people can really institute a similar model. They have to be very proactive with their administration. I've been very fortunate that my administration believed in me and believed in this care model, but they are going to have to get on board. All these other administrations are going to have to realize this is not the future anymore. It's the current way healthcare is going. And as we tie things to value-based care and value-based care models, these models we hope are going to become more common. But again, most importantly, I don't want people to do it because they're going to make or save money. Do it because it's the right thing for these patients and their families. This is what they need and they benefit from. I've actually become more efficient in my use of time because I'm not having to focus or spend energy on things I'm not trained to do or I'm not very good at doing. When there's a school issue, I can call my neuropsychologist to come right there and see them. Or if it goes even further, there's a medication question, I ask my pharmacist to do that. Teaching on exactly things like the importance of folic acid for when you're on an anti-seizure medicine, can be done by the person who knows it the best, the pharmacist. And so it's a really neat program that we're very, very proud of.